At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. So I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Of course, thank you for listening each and every week. And a special hello to anyone who's new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 620 AM from 9 to 10 in the morning. As I quite frequently start off, I tell you about what we typically do in the first half hour. If you are new to the show, again, in the first half hour, we talk about the very unique and wide variety of treatment options we offer all under one roof for almost 50 years now here at the American Back Centers. And in the last 20 years, Dr. Miskovich, who started this practice, as I mentioned, almost 50 years ago now, he was one of the first doctors here in the local Wexford area, way back when this area was almost like a cow path, and it's unbelievable how it's grown up and all the growth and businesses, and a lot of people moving out this way too because of the taxes, and especially in Butler County, and a lot of growth in this area that has just changed in the last 15 years since I've been with the practice. I was an associate for 5 years, and I've been the owner for now over 10 years with this practice. In the last 20 years, as I mentioned, our office has been known as Pittsburgh area's disc specialty center. We've been doing this again for 20 years now, one of the most experienced centers in the country, instituting the best state-of-the-art, latest and newest, most researched treatment called VaxD. And yes, VaxD is a 20-year-old treatment, but they have perfected their protocols. We have the latest and newest VaxD tables here at our office, so we don't have the old technology. We have the new technology. And VaxD still is the only non-invasive, non-surgical medical device that has been proven through clinical research. All other so-called decompression disc treatments cannot claim what VaxD can claim because it has a research done by Ramos and Martin, two neurosurgeons back in 1994, published in the Journal of Neurosurgery, showing for the first time and so to date the only non-invasive, non-surgical device that has been proven to create negative pressures upwards of a negative 200 millimeters of mercury, reducing the pressure in the disc, unlike traction, unlike these so-called stretching devices that you see out there advertised. A lot of people that come in, they say that VaxD looks similar to what their doctor has, and I have to shake my head because only VaxD, again, has done the research, and there's a lot of devices that try to look similar in looks to VaxD, but VaxD is a patented procedure that has a research supporting it, and again, it's patented. It's used worldwide. It's used by medical doctors, orthopedic surgeons in private practice, physical therapists, doctors of chiropractic, all over the world now. There's approximately 3,000 patients a day that see VaxD as the best and the only research treatment to actually treat a disc by reducing the pressure and pulling it back in place. And that's what the cause of the problem is the compression on the spine, leading to degenerative disc disease, starving of the disc, desiccation, leading to osteophytes, arthritis growing. When I say arthritis growing, the bones, like a stalactite and stalagmite, which I talk quite frequently on this show, top and bottom will eventually fuse together. You can do all the pain pills, all the epidurals, all the pain shots, all the physical therapy. Again, we do therapy here at the office, but as I always state, there's a time and a place for it. And you're not really treating the disc when you're doing therapy or traction. Traction just stretching the body apart. These decompression treatments you hear out there advertised without any research that there's no proof that they actually reduce the pressure within the disc. All they're doing is stretching the body apart. So you may as well just go on an inversion table at Costco, go buy one at Costco or at Sam's Club, an inversion table. You're not going to get anything different with that. And the inversion table is just simply to stretch the body apart, may help with muscle spasm. Patients come in all the time, they ask me, should I use my inversion table at home? And I tell them, if you have a disc problem, there's no evidence whatsoever it's going to heal a disc, pull a disc back into place, allow fluid and nutrients. to come back in the disc. In fact, there's doctors claiming that their decompression treatments will do the same thing as VAX-D without any research. They may have research stating that their procedure has helped patients, but there's no true evidence that it actually pulls fluid or nutrients back in the disc or reduces the pressure in the disc or creates negative pressure, and that's the key. You may help a few patients with any device, traction, inversion tables, whatever it may be, but you really want to see the pre- and post-VAX-D MRIs, and you can see the proof is in the pudding with VAX-D. Fluid is being returned to the disc. The height is being returned. The disc material is actually being pushed back off the nerve back into place. Only VAX-D has this. You can see the before and after MRIs. You can see the patients. It has many, many thousands of testimonials, 3,000 patients a day being treated. Professional athletes, NBA, NFL, NBA. We've had, I mentioned we've had professional actors, if you want to call them obviously professional, but they're actors, famous actors, come to us because they see VAX-D works, and they want VAX-D. They don't want these so-called decompression devices that have no real proof that they actually do what VAX-D does. All right, in the second half hour of the show, we typically talk about a nutrition or fitness-related topic. We've had some guests on the last few weeks. Healthy Hemp Solutions was on, Jay Miranda. We're very happy to have him on, talking about this exciting new products, hemp oil and the hemp cream, topical hemp cream, which we're selling a lot of. If you'd like to try either or, the cream is more for pain, arthritic pain, severe pain, in many cases where your prescription drugs are not touching. I have a gentleman that comes in. He had a knee surgery that went bad. He ended up having a severe infection. And the only thing that gave him some relief during the healing of the infection was the topical hemp cream. He was taking high-dose narcotics, painkillers, and such, and nothing was really touching it. He put the hemp oil on the level 5, the highest level CBD hemp oil, and that's the only thing that allowed him to function while his infection was healing. And it's amazing. And then the hemp oil, the sublingual, under your tongue, of course, hemp oil, they've seen good results, as Jay Miranda mentioned when he's on the show, with epilepsy, with seizures, autism, the tendencies that go along with autism, helping to reduce the negative behaviors with autism. A lot of parents are seeing great results with their kids, as well as tremors with Parkinson's as well. So if you'd like to try this, this is one of the highest potency hemp oils. There's a lot of different hemp oils out there. Charlotte's Web is a great high-quality product and very high potency, and they're seeing superior results with it. We also have a very good price. I know the products can be quite expensive, and our prices with the Healthy Hemp Solution, we can keep the price down. So if you'd like to try the hemp oil, sublingual, or the cream, give us a call. We can send it to you. You can pick it up right here at American Back Centers. Last week we touched on the natural remedies for prevention of dry eyes. That seemed to be very popular, especially on Facebook as well. If you'd like a copy of anything we talk about on this show, you can go to our Facebook page, American Back Centers Pittsburgh. Again, American Back Centers Pittsburgh. That's our Facebook page. If you know how to get on Facebook, you have to have an account first. You can very simply make an account and then go onto Facebook and visit other people's accounts or pages, they call it, and then you can print off the information from really the last year of our show. We've been doing it for the last year now, putting the health articles on the Facebook page, American Back Centers Pittsburgh. And this week, the dangers of flip-flops. We're going to talk about why flip-flops are not the best thing to be wearing for your back, your knees, your hip. We can give you some alternatives. We're going to be touching on if you have to wear flip-flops. We have the custom-made orthotics that actually can be built into the flip-flops, so we'll touch on that as well. And some of the dangers of flip-flops and some of the other things you can do as an alternative. We'll touch on that in the second half hour of the show today as well, so definitely stay tuned for that. We'll also have some nutritional items, new products that we're offering here at the American Back Centers that we highlight right before the nutritional segment as well, so definitely stay tuned for that as well, that we're seeing great results with our patients. So, of course, the American Back Centers, you are not your typical chiropractic office. As we mentioned, since 1994, when we started specializing in disc conditions. Of course, our office has been around for almost 50 years now. But since '94, the American Back Centers has been known as Pittsburgh area's disc specialty center. We have the experience. We perfected our protocols. Nobody does it just like we do it here. We continue to get better and better. And with that, our success rate is well over 90% if we accept you for care. And again, the only way you're going to know if you'll be a candidate for the treatments is by coming in and scheduling a free consultation. We'll tell you how to do that here in a few moments. So some of the most difficult cases we've seen here as a disc specialty center, including herniated disc, bulging disc, failed back and neck surgery, sciatica, stenosis, degenerative disc disease, and other serious health issues that many doctors have not been able to help, but we have. And just because you've had failed surgery, back or neck, we've helped literally hundreds of patients with failed surgeries, many patients that are right on the doorstep of getting surgery. We always tell them, get a second opinion first. Please get a second opinion before you blindly undergo the knife. Many people, you just have to shake their head. I have to shake their head as well. They tell me that, why didn't my doctor tell me about this? And I hear it every single day. Why did my doctor not tell me about this? Many doctors do, but there's still many doctors that are not aware what VAX-D is. There's some doctors that think just because this is a chiropractic run facility that VAX-D is a form of a chiropractic adjustment, and we're going to be adjusting you when you have a huge disc herniation instead of treating the disc and doing other things that may disrupt it. And again, the chiropractic adjustment can help many, many disc cases, but in some cases where the disc is quite severe, you're not responding to your adjustment, you're not responding to your physical therapy. In many cases, again, those treatments are not directly treating the disc itself, whereas VAX-D does, and sometimes you got to settle down the disc first, get things stabilized with the disc first. That's what VAX-D does in our protocols here with VAX-D, stabilizing the area, restricting your activities, reducing the inflammation naturally through our natural protocols here at the American Back Centers. Once things settle down, then you slowly incorporate the therapy, the rehab, and chiropractic back into the program, which is extremely important, but not in some cases the way to solve the problem when you have a more severe case. So we see that very commonly here at our office, and again, seeing some of these most difficult cases and helping these patients. So it's a time-tested treatment, a very safe treatment, a cost-effective treatment, used in over 300 facilities, hospitals. There's a few hospitals that have VAX-D, medical, orthopedic surgeons, chiropractic and physical therapy clinics worldwide. Again, approximately 3,000 patients a day are currently being treated with VAX-D. VAX-D standing for vertebral axial decompression. I hesitate to even say decompression because it's so loosely, I say this over and over, used these days. There's pump-up devices that go around your neck. There's all type of devices that they call themselves decompression. It's just crazy what you can call decompression these days. But if you know actually what the definition of decompression is reducing pressure. Now, you can have surgical decompression. You can have this type of decompression where you have a machine opening up the disc space, creating negative pressure, reducing the pressure within the disc, overcoming that natural reflex muscle spasm that occurs naturally when you try to stretch the body apart. And that's what they see with traction and these decompression devices, these disc treatments out there. There's no proof, and that's the key here. There's no proof that they're able to overcome that. VAX-D with a logarithmic time curve in the patented technology was able to overcome that. This was replicated through research published in peer-reviewed medical journals that the pressure is reduced to negative levels. That's the essential thing that you need to do to affect the disc. Reduce the pressure, not increase the pressure. The problem with traction was the pressure was actually increased when they added poundage to the patient, and that is obviously contraindicated and can make the patient much, much worse. Whereas VAX-D, you don't see that. So each week as I ask you, if you're out there listening, you yourself, or you know someone who's suffering with severe back or neck pain, unresponsive to your current treatment, you want to avoid further pain medication, epidurals, pain shots, physical therapy not working for you, you're contemplating surgery, you're scheduled for surgery, you've already had a failed surgery, come and talk to us first before you blindly get a second surgery or a first surgery. each subsequent procedure, surgical procedure, has a lower success rate and a higher rate of permanent complication. We all know what those are: infection, bleeding, blood clots, scar tissue. We see it every day with surgery. We talk about on the show all the time how they just snip off a piece of the disc. That snipping off a piece of the disc does not address the compression, the cause of the problem. We're structurally going after the cause of the problem by opening up the space, restoring the height, restoring the fluid and oxygen to that starved, desiccated disc, halting that progression of those bone spurs, that fusion of the vertebrae, and total destruction of the disc. We're also not allowing for further compression, which will lead to further bulging, herniation, extrusion of the disc. And if you have a herniation, bulge, or extrusion of the disc, we're able to pull that disc material back off the nerve, out of the canal, relieving your spinal stenosis, relieving your sciatica naturally through the negative pressure, the vacuum that is only produced with VAC-C therapy. So if your symptoms are radiating into your hip, your buttocks, your groin, down your leg, numbness and tingling, weakness, foot drop, those are very common symptoms and presentations we see here at the American Back Centers. We simply take the disc off the nerve. Also, restoring the height and fluid to the compressed, starved disc, naturally healing the problem without surgery, without cutting, without medication, and all the side effects that you can have with these procedures. Again, this breakthrough technology was developed by Dr. Alan Dyer, the former Deputy Minister of Health of Canada, who pioneered the research on the heart defibrillator used all over the world. Research to develop the VAC-C treatment was conducted over a period of 6 years with the combined efforts of physicians, engineers, and technicians at major hospitals. So we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today. Our toll-free number to schedule your free consultation with the doctor is 1-888-222-8293. Again, 1-888-222-8293. Again, that's not 1-800. It's 1-888-222-8293 or 724-935-3300, 724-935-3300. Again, we do have people coming from all over the country, all over the tri-state area as well, of course. We do have a list of hotels on our website, www.americanback.com. Again, www.americanbackcenters.com is our website. You can actually request an appointment on the website. We'll get back to you within 24 hours to see if that is open. We do book up very, very quickly, and we do have people that do have to change their appointment time, so sometimes we can get you in. We do try to accommodate. As I mentioned, I've seen 4, 5, 6 new patients in one day, even with all the other patients that we see, to try to accommodate emergency circumstances. If you're in severe pain, even though we have tons of people booked in, we will try to squeeze you in if it is a true emergency circumstance and you're in severe pain. Or you're contemplating surgery and you have surgery scheduled, it's something that you may want to get in for before you undergo that surgical procedure. At least talk with us and see if we can help you. Make sure you bring in your MRI, your X-ray if you have those. And when you come in for the consultation, you can also fax over the reports. Our fax number is 724-935-3321. 724-935-3321 is the fax number. Just remember where you had it done. Ask the facility, the hospital, the MRI facility to fax over your reports, not the films, because you can't do that. Fax over the reports. If you can pick up the films, that would be great. Just stop off at the facility, pick them up, and then bring them with you for your consultation. Again, our number is 724-935-3300 to schedule your consultation. 724-935-3321 is the fax number to fax over reports. And our website is www.americanback, B-A-C-K, B as in boy, A-C-K centers, plural.com. You can request an appointment, visit our website. There's great sections on what is VAC-D, the benefits of VAC-D. Is VAC-D right for me? What is causing my back pain? We have other services section. We have a whole list of other services we offer here at the American Back Centers. We have a blog and patient education section on the website. meet the doctors and staff, testimonials, contact information, as well as request an appointment right on the website. We have also a link to our daily health update newsletter. It's a great one-page newsletter of health tips and a quote for the day that we send out once a day to your email free of charge. When you sign up for the daily health updates, you'll automatically get signed up for the monthly In Good Hands newsletter. That's a wealth of information from all over the country. Doctors from all over the country add to this newsletter, and it comes out once a month. It's about a 10-page newsletter that you get free of charge when you sign up for the daily health update newsletter. These are great health tips to start off your day. If you don't have a chance to look at it, you can just delete it or pass it by, and the next day you'll get new health tips, updated health tips, and a quote for the day each and every day. Send to your email free of charge, and again, the monthly In Good Hands newsletter, both a free service of the American Back Centers. So go to the website, sign up for that today. We'll get you signed up, and we'll get you going with the newsletter, both newsletters, free of charge. So check out the website, www.americanbackcenters.com. Also, our Facebook page, American Back Centers Pittsburgh. A great way to see all the health articles that we put on our radio show. We talk about it on the radio show. You can print them right off from the Facebook page. If you get a second, we'd appreciate if you like our page. Visit the page and just click on like. We would greatly appreciate that. And check out our page, again, American Back Centers Pittsburgh. All right, in addition to the VAX-D and the, I'll get to that in a second, the cervical decompression, the VAX-D, of course, is a medical procedure, the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. We also offer cervical disc treatment options. If you have a bulging, herniated disc in the neck region, degenerative disc disease, posterior facet syndrome, you're contemplating neck surgery, you have failed neck surgery. We've helped hundreds of patients in these scenarios. So if you have a disc problem in the neck, contemplating surgery, already had failed neck surgery, give us a call. Again, in addition to having the best treatments, we have the expertise. We have the programs, the protocols that go along with the procedures. The procedures are important, but the protocols that go along with it, too, are extremely important as well. We do rehab and therapy in addition to that's part of the protocol in addition to the machines. Chiropractic, massage, nutrition, all these things come into play when treating a problem. So our protocols are unique and extremely effective for the disc in the back as well as the neck. We offer state-of-the-art facilities, individualized programs, ergonomic and postural instruction for therapy and rehab, wrist, hand, finger, foot, ankle, knee problems, tendonitis, rotator cuff, tennis elbow, golfer's elbow, carpal tunnel, frozen shoulder. Some of the many things that we see here at the American Back Centers. We have a great massage therapist instituting deep tissue massage, myofascial trigger point therapy, acupressure, reflexology, comprehensive nutritional consultations, custom-made orthotics, which we'll be touching on more in the nutrition segment, computerized digital scanning. So we're giving a true. We used to put your foot in the casting kit and press down. We've seen there was a lot of error with that. I mean, not a lot of error, but you have some error with the doctor pushing, the patient pushing into the cast. In some cases, you can see how you can have error there, where you're not pushing down correctly, maybe pushing more on the outside or the inside. With the new 3D digital scanner, you have no error whatsoever. You're simply just standing with a balanced stance on a platform. It scans 1 foot at a time. It gives you a truly 3D image of your foot. In that scan, we take a look at, the program assesses any possible issues, weight-bearing issues, arch issues. You have 3 different arches of the foot. It shows you the weight-bearing via 3D scan. And if we decide that orthotics are recommended or essential in some cases, because it's so bad, just had a patient the other day where all 3 arches were just totally gone. She was off the chart. I think the scale goes from 0 to 150, and she was like up at 160, which is just totally off the chart, one of the worst I've seen. It basically stated orthotics are essential, imperative, or else she would end up with having more back issues, knee, hip issues as well down the line. And this is how it starts. And we talk about how people sit at a desk, forward head posture. All these issues that develop can get worse and worse over being addressed properly. So with the custom-made orthotics, we send a scan to the company. Within 5 to 7 business days, they send back a digital scan, a custom-made orthotic based on your digital scan of your foot, and it goes right into your shoe. And in the case of the sandal, which we'll be touching on later today, can be built right into a flip-flop sandal, so you have that correction all the time. Acupressure treatment, in-house X-ray, nerve conduction, ultrasound testing done right here at the American Back Centers as well. We have a convenient MRI facility right across the street from our office, and I'm a certified personal trainer, so I can help you get back into the gym and do things correctly, and that's important as well, so you're not re-injuring yourself. So as we mentioned, our protocol is physician-directed. Our protocol engages other modalities on a case-by-case basis, and we have over 20 years of experience. So we're one of the most experienced facilities in the country, not just this area, treating these type of cases, and we're the facility that has VAX-D. And VAX-D is unique in that it's approved by the FDA for these type of problems, and it has the research supporting it actually does what it says it does, quite simply. We screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help them. So if we can't help you, of course, we will refer you out to the appropriate specialist. The VAX-D table and its computer work with each individual patient, adjusting back tension, which in turn adjusts interdiscal pressure within the disc. Moment by moment, the computer adjusts the tension in small amounts so that the muscles, low back, do not spasm or contract during the treatment, which allows for true decrease in pressure or reduction in interdiscal pressure to take place, or, quite simply, true decompression to take place. So we do offer the free consultation at no cost or obligation. We encourage you to bring in a family member, friend, neighbor, somebody with you. Number one, it's helpful to have somebody drive you out here if you're in pain. Bring in your MRI, your X-ray if you have it. If you don't have it, we can send you right across the street. If we need to have one before we can accept you as a patient. And most importantly, answer any questions you have about your problem, do a detailed history, physical exam, assessing if you're a candidate for the VAX-D, the cervical disc treatment, or any of the treatments we mentioned today that we offer here, all under one roof right here at the American Back Centers. We offer that free DVDs, which we touch on every week. Channel 11 put us on the news a few years ago on medical breakthroughs on Channel 11 News. They heard about all the success we've been having helping people with VAX-D. This is on a free DVD. You can pop it in your computer. If you don't have a DVD player hooked to your TV anymore, put it in your computer and watch it. It shows you VAX-D in operation as interviewed on Channel 11 News, and there's some great patient testimonials on there as well. We also have a 24-page Keller booklet describing all the ins and outs of VAX-D, which we can send to you. Also, of course, you can visit our webpage, which has a wealth of information on VAX-D. There's a couple videos on there, a different video than the one we send out. CBS News in another city had a report on the VAX-D as well, which is on our webpage, www.americanbackcenters.com. You can check that out as well. We can send you out the DVD when Channel 11 did a report on our office and the 24-page Keller booklet. We also have the research papers we touch on every week. The first paper we're very proud of. This research is done right here at the American Back Centers and later published in the Canadian Journal of Clinical Medicine on VAX-D. We also have the Knife in the Back article showing the failures of back surgery and why surgery is not always the best approach for chronic back pain. Especially this article touches on fusion surgery and why it's such a money-making procedure. Even though it's not working, there's all these complications with these rods and screws and not really addressing the cause of the problem and now the compensation that's occurring above and below with these fusion procedures, but they continue to do them because they make tons of money pre- and post-op with these procedures. We also have the Blue Workers' Comp book and the Yellow Auto Accident booklet. Great booklets done by attorneys. And again, these attorneys won't be calling you and hounding you. They're out in Philadelphia. But they're kind enough to send us new booklets every time we run out of them, and we do run out of them very quickly. But we do have enough right now for, say 10 to 20 callers that call in today or the next few days to have the books, because we have those in stock. And when we get low, we just call them and they send them out. And they send them out to us every 2 to 3 months, if not more, when we need them, because we go through them very quickly. And so many people realize that they're being taken advantage of by workers' comp insurance companies, the employers. They're told these blatant lies about what they can and cannot do. In many cases, they're told to go back to work. They're forced back to work. In many cases, they're given a diagnosis of a sprained strain when they really have a disc problem, or the insurance companies are hesitant to do the MRI to confirm the disc problem. You've lifted something at work. You've been involved in a whiplash car accident. You may have developed radiculopathy down your arm, your leg, pain down your arm or leg, numbness and tingling, which may be a disc problem. And they're hesitant to order the tests. Come and see us, and we can do that for you. We can take a look and see the extent of your problem. These workers' comp doctors, in many cases, just want to send you back to work as soon as possible. And that's just the game they play. So these booklets outline that. So ask for the blue workers' comp booklet, yellow auto accident personal injury booklet, showing you your rights as an injured worker or injured car accident or personal injury person, so you're not taken advantage of. They are free. Call, ask for the blue workers' comp or the yellow auto accident booklet, free of charge. 724-935-3300. All right, a little bit more information on the VAXD therapy. Again, the VAXD is a revolutionary, non-invasive, conservative treatment for patients who suffer from chronic low back pain, as well as leg pain, numbness caused by herniated, degenerated disc, extruded disc, bulge disc, slip discs, posterior facet syndrome, and failed back surgery. People who have had back surgery yet continue to experience pain may also be a candidate for VAXD therapy. VAXD is the only medical device that delivers treatment through its patented logarithmic decompression curve. The treatment is designed to relieve pressure on structures that may be causing back pain, usually associated with bulging or herniated disc or degenerative disc disease. VAXD is safe, effective, does not involve the risk associated with surgery or injections used to treat chronic back pain. As we mentioned, studies have proven that VAXD reduces pressure within the disc from positive to negative pressure. It creates a vacuum effect on the disc and allows for suctioning of the disc material back into its original position. A 4-year study has showed that the majority of patients are still pain-free 4 years plus after completing VAXD treatment protocols. That is just amazing. So it's showing that as long as you follow the programs that we outline here, VAXD will be a permanent correction, not just a temporary correction. So with VAXD therapy, as we mentioned, it's a very safe procedure. We talk about, coming in for your consultation to see if you're a candidate. If you are a candidate, there's a over 92% success rate if we accept you as a patient here for the therapy. Some of the questions we've had, if I've had back surgery, can I still do VAXD? Having back surgery does not prevent you from having VAXD. These type of things we touch on. Even patients with fixed hardware, as long as the entire back is not fused, may in fact benefit from VAXD, the areas above and below that are being compensated by the fixed hardware can be helped because they are suffering from that fusion. The areas above and below that may already been a problem, now they get worse now because they have to compensate for that fixed segment that's not moving anymore. That's a big problem. Is VAXD better than surgery? In most cases, better than surgery. This is due to the fact that surgery physically alters the spine by removing all or part of the problematic disc. Although this can reduce the pressure on the nerve and relieve some back pain, surgery tends to place more stress on the healthy disc above and below, creating future problems in those areas. So you may get some temporary relief, and they may call the surgery successful, but is it truly successful? Because now, down the line, you're going to have more problems. Complications from surgery can be severe and may result in disabling conditions. Clinical studies show that VAXD is successful in the majority of cases if accepted for care, and a study performed in 2006 showed that surgery was no more effective than conservative treatment 2 years later. So it's very important to note that VAXD has the research, has the documentation. 3,000 patients a day are being treated with VAXD therapy. How is VAXD different from the decompression or these disc therapy treatments I see advertised on TV and radio, especially here in the Pittsburgh area? Many patients and physicians have asked if VAXD treatment is different from traction or these decompression therapy treatments. In addition, the emergence and success of vaccine therapy has spawned a host of new medical devices, all claiming to be the same as vaccine in their principles of operation and their success rates. This has created a lot of confusion and questions about the similarities and effectiveness. Many doctors with simple traction devices are advertising them as decompression or disc therapies, coming up with these fancy names for these disc treatment options. Although traction devices may stretch the low back, they have not demonstrated the ability to decompress the lumbar spine and spinal nerves. It is mind-boggling that these providers may make these claims that cannot be backed up through legitimate research that has been published in peer-reviewed medical journals. What does traction actually do in these so-called decompression devices? Traction does stretch the spine, but that's all it does. It's been around for over 50 years. If it worked, we wouldn't be discussing VaxD. Traction tables have a small electric winch that attaches to the head of a table. A lot of these decompression devices try to cover that up by making these fancy columns and computer screens, trying to cover up the fact that they're a glorified traction device with a electric winch attaching to the head of the table. A rope and a pulley are then attached to either a cervical neck device or a low back belt. Either constant static or intermittent traction modes can be chosen, but neither have been shown to reduce interdiscal pressure like VaxD does and decompress the disc and nerves. Remember, VaxD brings the pressure down to a negative 200 millimeters of mercury inside the disc, reducing the pressure within the disc. So next week we'll touch on some of the other research that these decompression device companies try to state that they have. We'll touch on more of this next week on the show, so definitely stay tuned for that. But the real question should be, why would you even think about surgery with all its complications and lack of success, not including the normal risk that you see, infection, bleeding, blood clots, and the permanent complications, scar tissue that can result with any surgical procedure. When VaxD is an option, VaxD is a non-invasive treatment with a much, much higher success rate than surgery, pain injections, physical therapy, or these so-called decompression traction devices. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner or first. Remember, VaxD addresses the structural issues, not just the symptoms. Truly decompressing the disc, restoring the fluid content, taking the compression off the spine of the disc, pulling that disc material off the nerve, relieving your spinal stenosis, your sciatica, your disc problem, herniated, degenerated, extruded, bulged, low back pain, and numbness and tingling, as well as even failed back surgery. Even patients with foot drop, neurological deficit, or help with VaxD. And again, we assess you. We do a very comprehensive physical exam and history. We see all these things every day. We see foot drop. We see weakness. We see loss of reflexes each and every day, and we assess based on your exam if we think we can help you. And we have over 20 years of experience. I've been doing it for 15. The office has been doing it for 20 years. So we've seen the cases. We know who we can help and who we cannot help. And if we do accept you for care, you have an over 92% success rate. Nothing comes close to that. And again, we talk about success rates. Many people claim success. If patients have some relief for whether it's a month, a week, a year, or less, they still claim success. Success is not a month, a week, or a year. It's permanent success. 4 years, 5 years plus after the therapy, patients are still pain-free as long as they follow our protocols. That success, that is a successful procedure, not a temporary successful procedure. This is a permanent correction, not temporary. And again, you have to take all these success rates you see here advertised with a grain of salt. Is it temporary or is it permanent? With VaxD, as long as you follow the program, it's a permanent correction. All right, we're going to go over a couple things before we get into our nutritional segments today. We have a couple great new products. We have a great protocol now for bone spurs, and it combines two products, and you can call our office if you have any questions about the products involved with that. If you have a bone spur in your shoulder, we've had patients via x-rays see the bone spurs dissolve, heel spurs in their heel, bone spurs anywhere throughout the body and the spine, as well as joints. We have a great protocol for that, combining two products that work exceptionally well. Call our office if you want some more information on that. We can send it to you. You can pick it up right here at the American Back Centers. We have a great new probiotic as well, which we're going to be touching on today as well. Our American Back Centers for Premier Probiotics, $50 billion in the product of the probiotic. It's guaranteed. $100 billion when they make it, and $50 billion by the expiration date. So you're getting a high quality product that's highly absorbed. And we talk about probiotics on this show all the time, the importance for your immune system, as well as overall gut health. We have a nice product for naturally restoring testosterone as well. We also have a take-home salivary test kit that you can do at home to see if your testosterone levels or you have a low T-score. It's very effective. For $30, it's your test kit, all your testing, and your postage to and from, and they will give you your test results. And they have a nice natural product. It's not testosterone. It's natural precursors. It's a much safer way, in my opinion, to produce testosterone naturally. And first, get your T-score. If you have a low T-score, then you can try the product. We can, again, you can get the T-score through your local doctor, or you can use this take-home kit. It's very easy. You just take 4 saliva samples. You send it back to the company. Again, for $30, this is all included. And they do the testing for you, and they tell you what your T-scores are. We also have a nice new product for as we get into the fall season, although we're not there yet. Ragweed, goldenrod, and all the environmental seasonal allergies will be coming back again. So if you are suffering with seasonal allergies, we have a great product for allergies. It's a brand new product, and we're seeing great results for it. So we can send it to you. You can pick it up right here at the American Back Centers. Great new allergy product for those seasonal allergies. It's natural and extremely effective. Just call our office, and you can try this today. We also have a nice product we're seeing great results with neuropathy as well as carpal tunnel. You can call our office if you want more information on that as well. Also, as we're getting into and we're finishing up the swimsuit season, you still may want to lose a dress size or a shirt size. We have a very safe procedure called LipoLite for slimming, shaping, and toning. Extremely effective. Stimulates fibroblasts to strengthen the collagen and elastin fibers to tighten and tone your skin. Slim, shape, and tone without any drugs or medication. We have a great program. It's very effective. Just about every, if not all of our patients that have undergone has lost at least an inch, if not upwards of 3 or 4 or 5 inches, depending on if you're doing 6 or 12 treatments. Wonderfully safe treatment called LipoLite. Give us a call for a consultation and see if you're a candidate for the LipoLite procedure. All right, so we're going to get into our nutritional segment today. Last week we touched on the natural remedies for prevention of dry eyes. Some of the summary from last week: more women than men suffer from a diagnosis of dry eye that often feels as if there's something gritty in your eye. A lot of people out there, you may be out there listening, and you may feel this constant grittiness feeling in your eye, and may leave the sufferer at increased risk of infection. You feel like there's something in your eye. And more women than men suffer from this. Your tears are made of 3 different layers of fluid secreted from 3 different glands around your eyes. This can influence the quality and quantity of your tears and thus reduce the potential for dry eye. Dry eye is triggered by, or aggravated by vitamin deficiencies, low omega-3, environmental factors such as smoke, wind, dry air, or screen time. Screen time meaning sitting and looking at your computer, looking at your cell phone, which we see so commonly these days, even when people are driving a car. So we touched on all that last week. If you'd like a copy of the article, visit our Facebook page, American Back Centers Pittsburgh. You can print it off from there. Go to Mercola.com, MERCOLA.com. We have some great tips from that article, especially at the end of the article, on natural ways to reduce and prevent dry eyes. All right, so the dangers of flip-flops is what we're going to be touching on today. This, again, is from Mercola.com. You can find this on our Facebook page, American Back Centers Pittsburgh, as well. Just print it off right from the page. Take a second to like our page as well. We'd appreciate that. Goes on to state, especially in colder climates, summertime means the bliss of putting away coats and boots and hauling out shorts and flip-flops. It's great to step outside, wiggle your toes, and literally cool off your heels without restriction. Best of all, you can slip them on and go. No lacing, no zipping, no buckling required. But are flip-flops your best bet for foot health is the question. You probably already know the answer is not so much. According to the U.S. Consumer Product Safety Commission, Natural Electric Injury Surveillance System reports 198,000 emergency room visits were due to shoe-related injuries, and flip-flops were blamed for 25,000 of them. Podiatrist and foot and ankle surgeon Dr. Long says summer is the time people with flip-flop-related foot conditions start showing up at her door. Most of them are due to unstructured nature of the flip-flops, which result in lack of support for your feet. Goes on to state flip-flops don't offer any arch or heel support and don't have the grip. You have to grip them with your toes to keep them on. Wearing them too long or for the wrong activity can cause a lot of different problems, especially you don't want to be playing basketball or soccer or anything that involves ankle stability, touch football, for example, while wearing flip-flops. You're just asking for problems. Dr. Jordan goes on to say from the Hospital of Special Surgery in New York, he says he sees a lot of people coming in for help with pain due to suddenly wearing flip-flops every day after having worn better constructed shoes all winter. Much of the pain comes from having too much pressure placed on your tendons and bones, known as the, quote, overuse injuries, even from altering your foot structure. The flip-flop shoes, or the fascination, flip-flop soles are usually made of cushionary rubber, foam, synthetic materials, fabric, or leather, some of which may even be made of plant-based materials such as hemp, which are naturally antibacterial, antifungal, and breathable. The popularity of flip-flops have a lot to do with their shower and beach-ready practicality. So while a few designer models may support a stacked or wedged heel, and others talk about an ergonomic sole, the vast majority are flat. A lot of people, especially women, enjoy collecting several pairs in different colors. They're casual, fun, and versatile. Much of the appeal is the wearer's ability to mix and match with different outfits, not necessarily for durability or even comfort. Flip-flops are generally pretty inexpensive, which is part of the problem because it typically reflects the quality and lack of therefore. Many can be purchased as little as $5 a pair. And Long contends that this popular footwear is generally fine if you're wearing them for a short period of time. But if you're wearing them for a long period of time, that's where the problems can be. So their trademark construction dictates they fit loosely on your foot. Thong-style or Y-shaped strap that passes between your big toe and your second toe with no supporting straps along the top sides around your heel. Many sandals do have these straps. Flip-flops do not. As such, there's nothing to protect these exposed areas of your feet. Wearing them on a routine basis may start causing a number of different problems, even injury. Podiatrists caution problems include blisters. If you're noticing you're having blisters all of a sudden now, well, that's probably why. Puncture wounds, torn toenails, low back pain, calluses, athlete's foot cuts, fallen arches, where your arches actually are now being diminished by wearing this flat shoe, this flat flip-flop, bruises, insect bites, sunburn, dry, cracked heels, hammer toes, bunions, and even viral infections. The hammer toe problems come from having to grip them with your toes to keep them on if you're going up or down stairs or through sand on the beach. If you choose to slip them on for a day shopping or walking, you're likely to start killing your feet before the day's over. In fact, Today's Show also reported results from a recent survey that 25% of women admit that flip-flops sometimes hurt their feet. People who open doors painfully scrape their skin off their tops of their feet, tripping and falling over their floppy flip-flops, slip right out of them when wearing them on wet surfaces or on hot, sweaty days and stub their toes. This is even true for children wearing flip-flops to walk or play in. Also, moisture from sweaty feet will eventually promote bacterial growth from flip-flops. More serious conditions such as stress fractures and plantar fasciitis, which I see every day here in my office, which is inflammation of the band of tissue stretching from the heel to the ball of your foot. They can also throw off your natural stride, which may cause shin splints or pain in your Achilles tendon. As we skip on down here, they talk about the flip-flops and expert advice and what to look for in flip-flops. The American Podiatric Medical Association recommends buying the most comfortable flip-flops you can find, made with soft, high-quality leather. In addition to that, I also recommend the orthotics built in. That's what I do as well. They have a nice quality flip-flop that you can purchase from Foot Levelers, the company that does the orthotics, and then they'll build the arch correction right into the flip-flop. So if you must wear the flip-flops, and a lot of people like to wear them in summertime, at least you're having the support to the arches, and you have that natural, soft, comfortable feeling, and you have the support to the foot. And still, you don't want to be wearing these flip-flops to be playing touch football or volleyball or any outdoor sports activity where you're going to need that ankle support. You should be wearing shoes, tennis shoes, because that gives you the adequate ankle support. In addition, the company that does the orthotics, they do have the sandals with the orthotics built in as well that have the side support straps for the ankle and heel, which I would recommend as well. More advice on flip-flop maintenance. He also talks about going barefoot in this article. We touch on barefoot earthing or grounding, literally connecting with the earth. As it's healthier than you may imagine, the body being electrical benefits from direct contact with the earth, can give you some health benefits. Studies show better sleep, less pain, tension, muscle soreness, stress, reduced electrical fields on the body, and improved heart rate variability, glucose regulation, and immune responses by earthing or grounding, walking on the earth. So we're not talking about concrete. We're not talking about your deck, your patio. We're talking about walking on the grass, on the earth. Now, of course, you want to be careful with the bees, especially with the children doing this. But walking on the earth has many health benefits, or called earthing. More advice on flip-flops. If you have no intention of throwing out the 82 pairs of flip-flops you lovingly amass, it's at least a good idea to break your feet into them gradually when warm weather arrives, not to do an immediate exchange. You need to build up into them. Don't go crazy right away. And we recommend this, too, with orthotics. When patients get an orthotic put in their shoe or their flip-flop, you're supposed to wear them just a couple hours a day and add an hour each week as you gradually wean into the correction. Same thing with summertime when you're jumping into those flip-flops. Don't wear them all day. Slowly introduce them. And again, I recommend, of course, getting orthotic built into the flip-flop so you have that support on the arches. You're not wearing that flat, unsupported flip-flop shoe, which is going to cause all the problems we touched on, bunions, plantar fasciitis, hammer toe, and the list was on and on and on. So the flip-flops are becoming a little worse for wear or begin taking on an unsavory odor. Some can be cleaned rather than tossed. He offers some tips on his website, McCullough.com, on several types and best ways to clean them. Sometimes it's as simple as throwing them into a washing machine. Rubber flip-flops can be scrubbed with an old toothbrush in the tub with water and liberal amounts of baking soda to make a paste. Let them sit aside for 5 minutes. Do the bottoms too. Rinse and set them aside to dry, and you're good to go. Also, you can soak them in a solution of half water and half white vinegar, which is a smell solution, followed by baking soda if necessary. Suede sandals may benefit from gently rubbing with fine grit sandpaper to get rid of scuffs and dirt. Saddle soap, like the type cowboys have used on leather saddles for decades, softens, cleans, and reconditions leather and helps deal with the odor. In a last-ditch effort to save people from themselves, at least those in the flip-flop category, today's offers this advice. Look where you're going. Flip-flops offer little to no protection against broken glass and other sidewalk debris. If you're not willing to give your feet a cover, at least keep your eyes open and remain alert, especially when you're wearing these flip-flops. Finally, if you'd like a copy of this article, of course, go to our Facebook page. You can print it right off, The Dangers of Flip-Flop, or go to McCullough.com. The story at a glance, the summary, the unstructured nature of flip-flops can cause a host of physical problems such as athlete's foot, bone stress, fallen arches, bunions, hammer toes. Wearing flip-flops can expose your feet to bacteria, virus, fungi infections, especially when your feet are wet or get particularly dirty, not to mention problems like tripping, bad posture, slipping when they get wet. Studies show walking barefoot offers many health benefits, as the flow of free electrons from the Earth's surface, grounding or earthing, may help neutralize free radicals, resulting in a wide variety of physical improvements. All right, we're going to quickly get into the probiotics, the 7-part series, which I've been promising you. Some of we touch on this over and over and over. What are the benefits of probiotics? And this is a guide to probiotics, 7 fast facts you should know. Probiotics, of course, have been one of the hottest trends in health for a good reason. The right kinds can help nourish your gut bacteria for your physical and mental health being. Yet I notice I say the right kinds, and this is very important. That's why what we offer here has a very high level, again, made with 100 billion, and has 50 billion even at expiration. A lot of companies claim to have a certain level, but little do you know, when they have 40 billion or 20 billion on the label, that's how much was put in it when it was made. And from the second it's made and when it's open, these are live organisms, so they start to die. That's very important to note as well. So this is made with 100 billion and is guaranteed even at expiration date, which is a year or so from now, to have 50 billion per serving. And it has the strands that are important for good gut health and immune system health. Number one, the most important thing to do before focusing on probiotics. For probiotics to do their work, you must optimize the conditions where their good bacteria will live and flourish. This starts with nourishing your microbiome with real food. We talk about the things that the probiotics eat and the things that are harmful. Probiotics, whether in food or supplement form, is to help to improve the amount of beneficial bacteria in your gut. If you eat processed foods or foods with added sugars, they will do the opposite of what you want. They will nourish the potentially pathologic bacteria in your gut. The bad guys love the simple sugars too, so that's not a good thing. So you don't want the sugars. You want the healthy bacteria, and you want the bacteria to be flourishing on good things, not the bad things. So we'll touch on this more next week. I just got the notice that we were short on time, and we do have to go. If you'd like to try our product, we have the best, in my opinion, probiotic on the market, and you can pick it up right here at the American Back Centers. We can send it to you free of charge. It's going into your entire tract, surviving through the stomach acid, going into the small intestine, coating the whole tract, not being destroyed by the stomach acid, giving you that bacteria where you need it in a high amount in the appropriate forms. All right, we are short on time, so I will leave you, as I always do, with some final closing thoughts. Why would you even consider surgery when VAX-D is available? Please be smart. Remember, surgery is a permanent procedure with possible permanent complications. A smart, educated person who regularly listens to this radio station and show knows this and will usually make the right choice for their health. I want to thank everyone for listening today. We'll be on next Wednesday, and every Wednesday, with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.